We have the dumbest system in the world for buying drugs. But I'm saying that not pejoratively, but accurately. Every other country in the world, without exception, has one buyer for all the drugs that its public drug care programs need. By the way, in many countries, they cover you for drugs or a fair chunk of drugs. We don't. We have private insurance for drugs. Maybe you have an insurance plan here, I don't know. In many other countries, that's public. Okay, but anyway, but we all have seniors drug plans in the provinces. So every other country has one buyer. We have 10. We have 10 formularies. They're all different. And each province goes out there and negotiates prices on behalf of its own citizens. So Nova Scotia, with 950,000 people, sallies forth to negotiate for 950,000 people. BC has 4.5 million people. Somebody goes and negotiates for BC, et cetera, 10 times. Every other country has one buyer. So rather than having 10 buyers, we should have one national formulary and one buyer on behalf of 34 million people, because you'll get a lower price if you get drugs for 34 million than for 950,000. Or Newfoundland with 510,000, right? This is crazy. Australia has 6 states. They run the healthcare systems. The federal government buys the drugs because they get a better price. Because we've organized healthcare in this country right from the beginning on the basis that within a generation, there should be equity. So we raise or borrow X amount of money that we need over here, and we spend it over here on healthcare. We buy healthcare services with the money that we raise through taxes and borrowing. Boom, in like that. But the demographics are changing. Now, for the next 25 years, there'll be more people over here consuming healthcare and fewer people over here working to provide the money for the people who are going to need the healthcare. And in drugs, if you're 75, the average number of drugs you take is 6. And 85% of people over 65 take at least one drug. So it's almost a universal need for people who are seniors. So we know that cost's going to go up. We just know it's going to go up. So you say to yourself, well, how are we going to pay for that? If it's $1 in, $1 out, the dollar out's going to go up. So it means the dollars in have to go up, or we have to cut spending on something else. So my children are going to have to be taxed more or get fewer government services to deal with my drugs. And intergenerationally, that's not fair. So I think what we should have is a national seniors drug plan, national, like the Canada Pension Plan, in which we use a social insurance model, not a tax model. So throughout your working life, you make a contribution every month the way you do the Canada Pension Plan. Your employer makes a contribution. The government makes a contribution. Pools of money are created. They're invested, as with the CPP board. And when you get to be 65 or 67, in addition to your pension, you get, after a deductible, your drugs. That evens out the intergenerational problem. If you don't use that system, then you're going to either tax the next generation more to deal with what your requirements are, or they're going to have to get cuts in other services because something has to give.